Hi, my name is Walid Tawfiq. I am orthopedic surgeon in Yeovil District Hospital in UK. This is another episode of problem solving practice for FRCS trauma and orth. This is adult pathology section. How to get the maximum benefit from this video? At least two candidates should be practicing to give feedback to each other. See the image or listen to the scenario. Pause the video after each question. Answer the question. Try to start broad. Use the algorithm used in previous videos. The next question will provide you with more information to direct you to diagnosis, treatment for this specific case. The feedback should be written to simulate the exam feedback as possible. The final treatment is not as important as the thought process itself and right algorithm. Try to practice that. Let's go. Case 1. 33 years old man, full of cross motor bike, landed on his left shoulder 6 hours ago. No gross deformity. He's tender all around with minimal movement. Describe what you see. What are the important points in history you need to know? How to examine this patient? What is your next step? How to follow up this patient? Treatment received. Patient had manipulation under GA in theater on the same day. Fracture managed conservatively, completely healed 3 months post-injury. This is the radiographs. Case 2. 44 years old man, full of his bike, when a stationary car pulled in front of him suddenly. He landed on his left shoulder. Isolated injury to the left shoulder. ED notes no deformity, tender mid-shaft left humerus. The patient resists any movement. The impression was soft tissue injury, has stiff netting. Describe what you see. What is your diagnosis? What do you expect from examination findings? Patient returned next day as he felt that his shoulder is not right. What investigation to confirm your diagnosis? You get another X-ray. You had a CT with 3D reconstruction. You confirm your diagnosis as a posterior dislocation. What would you do now? You decided to take the patient to theater. You have achieved reduction. The reduction is stable. You put him in a normal arm sling. While in recovery, the patient felt that his shoulder is not right again. What would you do? That's your intraoperative reduction image. Describe the technique of closed reduction of posterior dislocation. What kind of sling you would use for immobilization? How to do an open reduction? Treatment received. The patient had a next day morning MUA. It was stable in external rotation. Had been immobilized in external rotation splint for 6 weeks. Check radiograph weekly for the next first 2 weeks. He achieved complete healing with no instability. He had an MRA, which showed a reverse Hill-Sachs with no other pathologies. In general, what are the treatment options for symptomatic Hill-Sachs lesion? Case 3. 75 years old man, had a seizure 3 weeks ago. He dislocated his shoulder and reduced in a sling. He missed his follow-up in another hospital. While he was rehabilitation phase 3 weeks ago, he continues had a shoulder pain with poor mobility and pain. Community hospital got an X-ray and contacted you. Describe what you see. What are the treatment most important points in history you need to know? How to examine this patient? What are further investigation you will need? The patient refused to have a non-operative treatment. What is your pre-operative workup? What other specialty or specialties you need to involve? What are the surgical treatment options? Treatment received. Discussion with neurologist. Workup done and seizure controlled. Open reduction through a deltopectoral approach. Modified McLaughlin procedure. External rotation splint for 3 weeks. Thank you.